Let's start this discussion with essential oils. There are a wide number of essential oils that have been shown to be beneficial in supporting healthy reproduction and sexuality. Rose, sandalwood, cedarwood, ylang ylang, neroli, patchouli, jasmine, and even cinnamon essential oils have been prized aphrodisiacs for many years. More recently, men have found benefits in more masculine oils such as blue spruce and goldenrod. Clary sage has a large body of anecdotal evidence to suggest that it can help with normal menstruation and menopause. And clary sage, along with tea tree, basil, and rosemary essential oils, can invigorate the mood around the time of sex. Clary sage has the added benefit of calming the mood. And we know that inhaling clary sage has been effective in reducing cortisol levels in healthy women. Playful essential oils such as melissa and orange can help to lighten up the mood around the time of sex. Both fatty oils and essential oils can interfere with the function of latex condoms. So if you choose to use latex condoms, be sure to use a water-based lubricant. If you want to combine an essential oil or a fatty oil into your sexual routine, select a polyurethane or a lambskin condom. Remember, lambskin is not vegetarian and it doesn't protect against sexually transmitted diseases. And polyurethane condoms can be a bit thicker than what people are normally used to with latex. Let's move on now and talk about some essential oil constituents and how they may impact our different hormone levels. In rats with drug-induced polycystic ovarian syndrome, the essential oil of white cedar, which is high in thujone, benchone, and saponine, significantly decreases testosterone and luteinizing hormone while increasing estradiol and progesterone. It had the added benefit of decreasing low-density cholesterol, which is our bad cholesterol, along with glucose and leptin. In a study of a small number of women with a mild increase in body hair on the face, neck, chest, and other areas typically associated with male body hair, lavender oil and tea tree oil sprayed on twice a day for 3 months decreased both the diameter and amount of hair on the body, and it did not produce any effects on hormone levels. When Niaouli essential oil is applied to the skin, it can promote the absorption of estradiol. So if you're using a medication that contains estradiol, you may choose to avoid Niaouli essential oil because it could lead to a greater pharmacologic action of the estradiol. We know that menstrual cycles in women who live together can become synchronized, and this is likely due to the various aromas that are given off in different phases of the menstrual cycle. Now, let's move on and talk about the use of essential oils while pregnant or nursing. One of the most hotly contested times to use essential oils is while pregnant, trying to become pregnant, or while nursing. There's no definitive list of what you should or should not use while pregnant. And much of the fear surrounding the use of essential oils in pregnancy comes from a lack of knowledge. In this section, I will present data on the use of essential oils in pregnancy, and I will rely on you to use your best judgment to decide what is the most appropriate for you. In order to subdivide pregnancy into a variety of categories, let's first look at fertility and implantation. Then we'll look at toxicity to both embryos and fetuses, as well as teratogenicity, or the formation of birth defects, as well as placental crossing of essential oil constituents, and finally, breastfeeding. Fertility is the first step towards pregnancy. For a woman to become pregnant, hormone levels of progesterone, estrogen, luteinizing hormone, and follicle-stimulating hormone, as well as gonadotropin-releasing hormone, must all work together to create an environment that is prepared for pregnancy. Citrol, in extraordinarily high doses, has been shown to impair ovarian follicle functions, and ovarian follicles roughly translate to our eggs. However, This was demonstrated in an animal study after repeated injections of citral into the belly, which would have been equivalent to approximately 25 milliliters of lemongrass essential oil. So, this is the first instance that we see in the data that the dose of the essential oil matters a lot in determining the safety of the oil. So, what to do? Citral is found in some of the most beloved essential oils, such as lemon, lime, bergamot, and many other citrus oils. You can choose to avoid them entirely if you want to be conservative. However, keep in mind the dose of the essential oil that was used in these studies, and be aware that you are likely going to be using much less than what was shown to cause harm. Though they did cause harm in the studies above, there have been additional studies which show no risk of harm to the embryo when citral-containing oils are applied to the skin at reasonable doses, and even when a few drops are taken by mouth. Use your best judgment to decide how you would like to use the citral-containing oils early in pregnancy and throughout the entire pregnancy. Carrot seed essential oil, also at extremely high doses of about 2.5 to 5 milliliters per kilogram injected into the belly, roughly equivalent to 175 to 350 milliliters in an average adult, has also been shown to block progesterone synthesis and therefore implantation of a new embryo. Several oils have been shown to have estrogenic activity, and estrogen spikes are necessary for ovulation. In vitro studies suggest that citral, geraniol, nerol, and E-anethol can displace estrogen from estrogen receptors, but they lack the ability to be recognized in estrogen receptor cell lines. It's been suggested that citral can also bind estrogen receptors. However, it failed to produce any estrogenic activity in mice who had had their ovaries removed. Another very old study demonstrated estrogenic activities of anise, phenyl, and E-anethol, and further studies have linked polymers of E-anethol to estrogenic activity. So, if you're in the very early phases of pregnancy and you choose to be conservative, you may want to avoid oils such as anise, phenyl, and oils that are high in E-anethol. And if you want to be extremely conservative, you can additionally avoid citral. Clary sage and its constituent sclareol has a strong reputation online for behaving as an estrogen in humans. However, there is good structural evidence to suggest that sclareol is not a good match for the estrogen receptor. There is evidence in vitro cell cultures that sclareol may bind the estrogen receptor, but data has shown that it actually inhibits the receptor and not activates it. This is not to imply that clary sage doesn't work, just that there's not data to finalize the debate on whether its actions are mediated through the estrogen receptor. We do know that women experience significant benefits from clary sage during the menstrual cycle as well as during menopause. We know that clary sage can inhibit COX-2, which is an important enzyme in pain modulations, our MMPs or our metalloproteinases, and these enzymes are important for normal tissue turnover, and clary sage can increase TEMP-P, which has a primary role to inhibit our MMPs. Clary sage can also inhibit nitric oxide synthase, and we know that low levels of nitric oxide are important for normal implantation, and that higher levels throughout pregnancy are necessary to sustain the pregnancy. We also know that a withdrawal from nitric oxide may also be an important step in the birth process. So clary sage certainly has some actions on our bodies that are important for normal reproduction. The good news is that the way I see women commonly using clary sage around the time of menstruation, when trying to become pregnant, or around the time of birth seems to be a reasonable reflection of its chemical actions. Many women choose to avoid clary sage during pregnancy, and this too seems to be a reasonable reflection of the data. Essential oils are very highly unlikely to interact with birth control medicines, because even if they can bind an estrogen or a progesterone receptor, the impact on the cell is exceedingly small compared to our endogenous hormones. However, in animal studies where very high doses of essential oils were administered, the essential oil constituents, as well as whole oils such as blue chamomile, peppermint, menthol, bergamottin, bergeptol, bergectins, and sorolin, have been shown to inhibit CYP3A4. We know that estrogens are metabolized by CYP3A4, so if we inhibit the metabolism, we may drive our levels of estrogens higher. Good potentially around the time of ovulation, not necessarily the best if you have an excess of estrogens in the body. There's no data to suggest that essential oils pose a substantial risk to male fertility. However, there are chemical substances and medications that can wreak havoc on the male reproductive system. Most of the studies of essential oils are in animals where substances known to be harmful to male fertility are used to first cause harm, and then concomitant use of an essential oil is used to assess the protective effect of the essential oil. First, the chemotherapeutic taxane drugs such as paclitaxel and docetaxel are well known to cause changes in sperm count and quality, decrease the weight of the testes, and change testicular and epididymal balance. And we haven't gone through the anatomy, but the epididymis is a duct behind the testis where sperm passes on the way to the vas deferens and out the urethra on its way out of the body. Rosemary essential oil and Lavandula stoicheus were both shown to have protective effects against oxidative stress and markers of reproductive organ damage, such as decreased weight of the testes and sperm quality decline in rats who had alloxane-induced diabetes. In healthy rats exposed to the inhalation of either formaldehyde alone or formaldehyde plus lavender oil, formaldehyde was found to have a significant negative impact on the male reproductive system, and this was evidenced by a decrease in epididymal sperm concentrations, decreased sperm motility, and abnormal sperm production rates. In the group that inhaled lavender oil alongside formaldehyde, abnormal sperm rates were decreased, and sperm mobility and sperm concentrations were both increased. Bottom line, there are some essential oils constituents that have been shown in vitro to have some estrogenic activities. However, the estrogenic activity is usually very weak and unlikely to interfere with normal pregnancy unless it's given at massive doses. If you want to be very conservative during this stage, you may consider limiting exposure to essential oils high in citral, such as your citrus fruit oils, geraniol, such as geranium, and E-anethol, such as anise, aniseed, star anise, aniseed myrtle, sweet, and bitter fennel. Next, let's move on and talk about the implantation phase. Implantation is when the embryo sits into the side of the uterus and prepares to start growing. During this phase, very high doses of subcutaneously administered savin essential oil and isolated E-anethol and bergectin given orally have been shown to reduce implantation in mice and rats. However, if we look at the bergectin data, it would require about 1.5 to 3 kilograms of lime essential oil by mouth, and therefore this data is unlikely to relate to humans. E-anethol, even at very high doses, did not pose a threat to pups when given on days 1 to 2 of a rat pregnancy. However, when it was given on days 3 to 5, it prevented pregnancy, and on days 6 to 10, pregnancy was prevented in about half of the animals. You may choose to avoid essential oils that are high in E-anethol if you're trying to become pregnant. In the newly developing embryo, rapid cell differentiation is important, and anything that blocks cell differentiation may lead to a failed pregnancy or a physical malformation. In a study where female rats were fed between 150 and 375 milligrams per kilogram for 2 weeks prior to mating of oregano and clove oil, it was found that this increased the rate of cell death. However, mice fed lower amounts of 100 milligrams a day of eugenol, the primary constituent of oregano, did not see these effects on the fetus. We also see in this same study that when cinnamon bark and Dalmatian sage is fed to female mice, the distribution of the embryos throughout the uterus changes. This has led to the addition of most of these essential oils, as well as chemically similar essential oils, to be included on many contraindication lists for use in pregnancy. During fetal development, essential oils, because of their size and their lipophilicity, are very highly likely to cross the placental barrier. However, just because an essential oil is crossing the placenta does not necessarily indicate a risk. What we again see is that the dose is very important. Because the fetal brain and the central nervous system in the fetus is not fully developed, it is likely that whatever reaches the bloodstream of the fetus will also reach the central nervous system. At very high doses and when injected subcutaneously, 1,8-cineol has been shown to cross the placenta and interact with fetal liver enzymes in pregnant rats. Importantly, the dose was 500 milligrams a day per day for 4 days, which is equivalent to several hundred milliliters of a cineol-rich oil in a human. We also know that eucalyptus oil injected subcutaneously at lower, yet still relatively high doses, has shown no toxicity to the mother or the fetus. There are a few essential oils that have been shown to cause substantial harm to fetuses in both humans and animals. At least 3 case reports of ingestion of camphorated oil demonstrate harm. First, a woman had a miscarriage following ingestion of approximately 57 milliliters of camphorated oil, and camphor was detected in the infant's brain, liver, and kidneys. In another case, a woman ingested, again, approximately 57 milliliters of camphorated oil and started labor within hours and gave birth to a healthy baby that had the distinct smell of camphor. Both of the babies in these case reports were full term, but in the second case where the baby survived, the baby was almost 3 pounds or 1.5 kilograms heavier than in the case where the baby did not survive. Another case report of a woman who ingested 45 milliliters of camphorated oil in month 3 of pregnancy. She gave birth 6 months later to a normal, healthy baby. So even at high doses, we know that camphor can cause some harm, but the harm is not consistent throughout the entire pregnancy. The doses of camphor in this study are more than 90 times higher than what's suggested for normal ingestion. However, if you choose to be conservative, you may choose to avoid oils that are high in camphor, such as feverfew, hoe leaf, Spanish lavender, and wormwood. Arguably the most dangerous essential oil constituent during pregnancy is savinol acetate, and this is found in high levels in savin, wormwood, Plectranthus fructicosus, and Juniperus spiceriana. Savinol acetate is known to be toxic to embryos and fetuses in rodents and has led to fetal resorption. This is where when you have multiple pregnancies going on and one of the fetuses dies and the cellular material is absorbed by another fetus. Malformations such as too small eyes, lack of eyes, as well as kidney and heart defects and skeletal malformations have all been noted with savinol acetate. It's likely a good idea to avoid all of these essential oils throughout pregnancy, as even small doses have caused harm to animal fetuses. The good news is that because of the risk of the harm to fetus and embryos, there are very few, if any, essential oil companies that market these essential oils. It's much more likely that the juniper on your shelf is Juniperus osteosperma, Juniperus scapularium, or Juniperus communis, and that the Plectranthus on your shelf is Plectranthus amboinicus. Wintergreen essential oil's primary chemical constituent is methyl salicylate. And salicylates have been shown to cause harm when they are administered subcutaneously, under the skin, intraperitoneally, into the belly, or by gavage, which is a way to feed essential oils to experimental animals. However, the data does not reflect harm when methyl salicylate is applied only topically. So if you choose to avoid wintergreen essential oil throughout your entire pregnancy, that's fine. However, my opinion is as long as you are just doing an occasional topical application, wintergreen essential oil is likely safe during pregnancy. We've also seen in a study after a 30-year-old woman ingested several cookies made with 7 grams of grated nutmeg instead of the 1/8 of a teaspoon that the recipe recommended, that the fetus's heart rate rose to about 160 to 170 beats per minute, but after a few hours returned back down to normal. This evidence suggests that, as with other studies, that essential oil constituents, even from food sources, can cross the placenta and impact the baby's physiology. But again, these are all found in very large doses. Like most substances in maternal plasma, small amounts of chemical constituents to essential oils have been found to pass into the breast milk, and this is likely via passive diffusion. It's estimated that about 1% of the maternal dose of an essential oil will reach the baby via the breast milk. Volatile compounds have also been shown in studies to enhance the flavor of breast milk and may have a positive effect on breastfeeding outcomes. Let's move on now and talk about some individual oils that get a very bad reputation for causing harm during pregnancy. Let's first start with rue. Rue the plant is used as an abortifacient in South America because rue the plant contains very high levels of pilocarpine. Pilocarpine is a cholinergic agent. Cholinergic agents increase the lubrication of our body, and some of them can act as uterine stimulants. Importantly, pilocarpine is not distilled extensively into essential oils, and therefore the potential risk to the pregnancy is reduced. The Food and Drug Administration considers rue safe for human consumption and has suggested that additional teratogenicity studies be carried out before determining if a risk of rue is present in pregnant women. There are isolated, obscure reports from the 1930s of rue as a uterine stimulant. However, how it applies to modern pregnancy is unknown. In massive oral doses, equivalent to about 210 milliliters in an average adult, there have been reports of harm to both mom and baby. And there have been some anecdotal reports of spontaneous abortion upon consuming massive amounts of essential oil. At more reasonable doses, still very high doses of around 900 drops at one time in an average adult, there have been no demonstrated maternotoxic, embryotoxic, or teratogenic effects. Besides the high-dose menthol studies that we've already discussed above, peppermint does not have a lot of evidence to suggest that it is dangerous during pregnancy. The National Institute of Health deems peppermint essential oil likely safe during pregnancy and nursing. Plus, the Food and Drug Administration's classify peppermint essential oils as generally recognized as safe for human consumption. However, peppermint does have some reflexogen activities, meaning that it can kind of choke off breathing in very young infants. And so it's likely prudent to avoid applying peppermint essential oil to the face of a young infant or to the breast immediately before breastfeeding a young infant or a toddler. We've already mentioned fennel a couple of times. Fennel is high in E-anethol, and as discussed above, many women choose to avoid essential oils that are high in E-anethol during pregnancy. However, many women use E-anethol during pregnancy. It all depends on what your body is used to and whether or not you feel confident that it's the right choice for you. Fennel may change breast milk output. In some women it increases and in other women it decreases. So it's unknown how each person will react if they choose to use fennel while breastfeeding. I recommend if you choose to use an essential oil while you're breastfeeding, Monitor your breast milk output, and if you notice an increase or a decrease in your milk supply, adjust your usage of the essential oil accordingly. So what about women who have a history of an estrogen-linked cancer? As we've already discussed, E-anethol has been shown in studies to potentially bind the estrogen receptor, and we have further data to suggest that when rats are fed E-anethol daily for 3 days, that there's a change in the weight of the uterus. This suggests an estrogenic activity, and many women who have had either an estrogen-linked cancer or endometriosis may choose to avoid essential oils that are high in E-anethol, such as anise, aniseed myrtle, star anise, and sweet and bitter fennel. So that was a lot of data, and it seemed to be all over the place and coming from every different direction. So what's the bottom line? Number one, studying the effects of anything, especially essential oils, is tough during pregnancy. We often rely on animal studies and case reports to guide us to our safety data. Another complicating matter is that many of the studies have injected very high doses into the bellies or under the skin of animals instead of applying small amounts topically or including small amounts orally in the diet. Additionally, many of the studies are of essential oil constituents, and then the data is extrapolated back to the whole oil, but we really have no idea whether or not that is an accurate representation of what is happening. Coming to the exact conclusion that an essential oil is 100% safe during pregnancy is also very challenging. But remember, 100% safety data is also not existent for most over-the-counter medicines as well. Here is some general advice that may help you along the way. If you are pregnant or plan to become pregnant, you may wish to avoid extensive use of essential oils that you have not used in the past. Excessive use of essential oils that are very high in thujone, camphor, saponal acetate, methyl salicylate, citrol, and E-anethol is likely unwise during pregnancy. Use caution, especially if you're choosing to take these by mouth, or you may choose to avoid them completely. You also may choose to dilute essential oils, even gentle essential oils, throughout pregnancy. Now that we've finished the discussion on essential oils and hormone balance in pregnancy, let's move on to talk about some herbs and herbal supplements.